Larry Rogina. He's an osteopathic doctor from Pennsylvania. He's been a friend of mine for many years, and he's a pioneer. And he's been a board-certified OBGYN for over 27 years. He delivered babies, did lots of surgeries, but he was forced into retirement because of a medical situation. And Larry, you've been a pioneer in health coaching and wellness, and I'd love for you, because you experienced some of these same burnouts and some of these same challenges that many physicians feel today. Tell us about your journey into moving towards prevention and wellness.
Thanks, Greg. I really appreciate being here. And, I have to go back to about 15 years ago. I took care of a lot of patients, and a lot of patients had medical conditions that were confounded by their obesity. And I can't tell you how many women I diagnosed with ovarian cancer, breast cancer, and uterine cancer. And lo and behold, I found that I wasn't in integrity when I was talking to these women, because a woman comes to my mind. I diagnosed her with a uterine cancer. I took her to the operating room. We did her hysterectomy, and it was curative, and I was delighted. But then she asked me, where did this come from? And so I explained it's from her unopposed estrogen levels. She was 5'5", 5'6", 350 plus pounds. And when I explained it was from her adipose tissue, she says, so you're telling me I'm fat? And I said, well, your obesity certainly didn't help, and it actually contributed to this problem. And then she poked me in the belly and says, well, have you looked in the mirror? And I knew at that point that I was out of integrity. I had that point driven home another time. I had a friend of mine who I skydived with, and he was in the wrong place at the wrong time, and he crash landed his parachute, and I knew when he impacted the ground, he fractured his spine. I ran frantically about 150 yards out into the field. At that time, I was over 300 pounds. When the guy laying there with 2 broken vertebrae looked up at me and said, Doc, are you going to be okay? I knew that I was not taking care of me. And even though he did fine and he recovered from his injury, I came to the realization that I wasn't the best that I could be. Let's fast forward a little bit. A couple years later, I met my health coach at a medical conference. And before I knew it, I started on a journey, and I lost about 75 pounds in about 6 months. And actually, it was amazing, and I felt absolutely terrific. I had energy, and nothing hurt. I wasn't the mean, nasty OBGYN that was always in back pain when I came home from work. I didn't have to lay on the floor anymore. So what did I realize at the same time? Well, I was working 40, 50, 60, 70, sometimes 80 to 100, and even 120 hours a week as an OBGYN and physician surgeon. I took care of all my patients, but I didn't take care of me, and I didn't take care of my family like I knew I should have. And, I just wasn't in integrity from a physical standpoint, and I was in integrity with the job I signed up for, which was to be a dad and a husband. And now a grandfather, which is actually even a cooler job. So let's fast forward. About 6 years ago, I developed a medical condition where I had a variant of the Guillain-Barré syndrome, and I ended up with permanent double vision. No longer could I practice medicine. I couldn't do surgery anymore because I just couldn't see well enough to do it. And I became permanently disabled. I sat on a couch for about 9 months, almost a year, feeling really sorry for myself. And then my coach asked me, what was your greatest accomplishment as an OB? And I said, well, delivering over 4,000 kids and probably doing as many surgeries. She says, well, with our team, we've impacted well over 100,000 lives, and you're a part of that. Just think how many lives you can impact now that you actually have some extra time. And lo and behold, I started to become a better coach. And when I became a better coach and I was only working part-time for a full-time plus income, it was kind of cool. I could be the husband, the father, and now the grandfather. I'm actually down in Charlotte babysitting for a few days while my daughter gets injections in her spine. So it's cool. I can't thank Dr. Anderson enough for giving me my health, giving me my life, and allowing me to spend time, quality time, as a father and a grandfather. And now I can impact so many patients' lives. It's amazing. Thank you, Greg.